George, David, thank you, and good morning, everyone. Let me add my thanks to you all for taking your time out of your busy schedules to be here this morning and to participate in this event to help Great Britain work well. This is an important conversation. It's a conversation we need to have in order to build on and to update a success story. Because health and safety in Great Britain is a success story, which goes all the way back to the Factories Act of the 1800s, which created the Inspectorate, the first of its kind in the world, and we have continued to lead the pack since then. We have a health and safety record that we can be proud of. And sometimes we forget to say that because we're all very conscious, as David highlighted so well, that there's always more that we can do. But the fact is that we are one of the best in the world. And that is a context which we need to be aware of because it creates both problems and opportunities for us. Let's just think about some of those challenges. One is that it is more challenging for us to identify what we do next. There aren't too many people who we can look to, who we can learn from, and who can tell us what the next steps would be. We also need to guard against being complacent, because there is more that we can do, there is improvement to be had, and we can't allow being the best to get in the way and make us complacent. But it also has other connotations. One of my big concerns, and which I hope many of you share, is that what I've seen during my time as chair of HSE is that in this search for continuous improvement, there is a strong temptation in many places to go over the top in setting disproportionate standards for our staff and our supply chains, forever going after less and less important issues and failing to focus on the things and the new things that we need to do to tackle the issues that haven't yet been addressed. We also work in a different environment and a different context. There's an increased awareness of health and safety expectations in our society, but that has led to some good and some bad things. The bad bit being the misuse and abuse in various ways of the term health and safety, devaluing what we know are the important things, again, which we've already referred to today, and the use of this term health and safety to cover a myriad of things, often as an excuse for many other things that people don't want to talk about. And I think one of the other issues that we continue to face is that because the safety issues, the things that will injure people, kill people today and tomorrow, are immediate, we have not yet put enough attention or enough focus on those things that take much longer to manifest themselves, but which have a serious impact on people's health. So those are some of the challenges that I think we need to be looking at. There's no doubt that the opportunity, rather than focusing on the challenges or the problems, the opportunity lies in this complex but interconnected health and safety system that we have developed and which has evolved over the last 40 years. We're all part of that system, and we can be proud of our achievements to date. But the future of this system belongs with everyone in this room. Whilst we took the initiative to set up this event today, we in HSE don't own this. We're part of it with all of you. We know we can make it even better, but we need to do that in a proportionate and a sensible way. That, for me, is the challenge. Better doesn't always mean doing more. And I think we need to avoid we need to do more, we need to work harder, we need to work differently. It's about identifying and managing risks, the real risks, and being smart about the solutions we come up with. We need to have the courage to say when doing less would be a more appropriate response that might lead to better outcomes. If risks are trivial or the risk management is over-engineered or over the top, then perhaps showing some common sense and some proportionality might win over the hearts and minds of some of our cynical employees. We need to act together to gain even broader ownership and commitment, and that means we need to talk. We need to share ideas, and we need to find the courage to take some of those new and different initiatives. We need to broaden the membership of the system, get people to feel that ownership, and we need to identify the synergies with other policy agendas, because health and safety does not exist in a vacuum or in isolation. All too often in too many companies, it's over on the side in a separate organisation, not properly integrated into the mainstream of the business. Employers, workers and their representatives, government and others who are part of the system all need to think about their own role and their responsibilities. It needs to be a conversation about what you will do, not what they need to do. And I want to hear from all of you today what you think you can contribute and how you're going to help make this system even better. I'm delighted to see so many of you here today at the start of this series of engagements throughout Great Britain. As you heard from George, over the next 2.5 weeks, we'll be running a number of similar events. On Thursday, we'll be in Wales. On Friday, we're heading to the southwest. Then we're doing the Midlands, the northwest, and York. And we will end in London with an event that will involve our minister on the 2nd of February. If you have other colleagues in other parts of Great Britain who you think would value being part of that initiative, who have things to contribute, then please encourage them to come and join us in those conversations around the whole of Great Britain. Because together we want to develop, and going forwards, not just develop the strategy, but deliver on that strategy for the health and safety system that will help Great Britain work well to 2020 and indeed beyond that. I want you to have 3 thoughts in mind today as we discuss the way ahead. And the first, as I've said, is a very personal one. Think about yourself, not your company, not the others, not what other people can do. Does your personal contribution to health and safety really help others? Or are you one of those people who creates bureaucracy and makes it boring and makes it tedious and really does turn people off? Think about that. Then I want you to think about ownership and responsibility for health and safety. Is it in the right place in your organisation? Does everyone look at the health and safety department and say that's theirs? Or is it properly and appropriately shared and recognised by everyone in the organisation that they have a role to play and a responsibility? And are they focused on the right things? Are you focusing on the right priorities in your business? And then, as I've said, we're going to come back to this personal stuff, because this really is about every one of us understanding what we can do. What could you personally do differently in 2016 and indeed beyond that, that will really help us to create an even better health and safety system in Great Britain? Talking about the strategy itself, so those are the 3 questions. We've got 3 aspects to our conversations that we're going to try and tackle. They can be described in different ways, but fundamentally they are, first of all, we want to pick up this issue of ownership, because it starts with you, and that is irrespective of who you are, where you are in the organisation, whatever your role, you have an active part to play in implementing the strategy and making it really come alive for you and for your colleagues. You need to help identify the most important challenges and develop ways of taking collective ownership. In our meeting earlier this morning with a small number who are now dispersed throughout this room, we talked about too many initiatives, all trying to occupy a crowded space. It's time we joined forces and got together and collaborated rather than all trying to compete in a crowded space. Collective ownership is what matters. That includes taking a good hard look at whether our own personal contributions to health and safety help people and businesses as much as they can, or don't create unnecessary cost or inefficiency. There's no question that we all care passionately about health and safety, and that's to be welcomed, of course. But ownership is going to be key, and ownership of the right things, knowing what our role is, what it is that we can do, and honouring that commitment to deliver. The second theme I want to pick up is about health. We have all achieved a great deal on safety over the years, but we all know that there is much more that can and should be done on health to benefit Britain's well-being and prosperity. For GB as a whole, some 23 million working days are lost each year through work-related ill health. And the annual costs to Great Britain are estimated at in excess of £9 billion. That's an enormous cost to the economy. And that's in addition to the costs from ill health problems due to working conditions of the past that we are still dealing with. I've said that health and safety can't be handled in isolation. And what I worry about a lot is how many organisations today have somehow got into trying to do that for some reason or another. This agenda is entirely compatible with growth and boosting Britain's businesses. We will only achieve better health outcomes and safety if businesses, and especially SMEs, are able to get the right information at the right time and take the right action easily and efficiently, and if they see it as an integral part of being a successful business. We in HSE have already simplified the stock of health and safety legislation and guidance to help companies. We've done a great deal over the last 5 years to make it easier for people to understand what they need to do, because we believe that will make it easier for them to do. But that's not enough. We and you need to help them focus on the right things and on the right ways to tackle that as an integral part of doing business. We need to banish this myth that health and safety equates to bureaucracy, and instead we need businesses to benefit from the productivity, the innovation and the growth it can bring. I know we can do this. I've seen some of those things happening in some businesses, but it's not that way in enough yet. We've set out 6 themes that will help us to focus our conversations and to help shape the content of the strategy. Once the strategy is finalised, we'll use those same themes to ensure we're all delivering on the intent. The first of these themes is about promoting broader ownership. I've spoken about ownership already, promoting that broader ownership of workplace health and safety. What do we mean by that? Why is it important? How can we achieve it? As I've said, it means engaging everyone who shares the responsibility for helping Britain work well. Because everyone has a vital role in effectively managing occupational safety and health, preventing accidents and ill health, which damage those people, their work colleagues, the business as a whole, and the economy. That's not an easy ask. How we get everyone to recognise their role and their ownership is something we want your help with devising the ways to achieve it. Ensuring people feel that they own part of the system rather than being on the receiving end of it is a challenge for us all. We will need to find ways to demonstrate the benefits of that ownership and of leading on health and safety for those people that haven't been fully engaged in the past and who have in the past seen it as someone else's job to look after health and safety while they run the rest of the business. The second theme takes us right into the heart of this matter of tackling the burden of work-related ill health. Last year, there was an estimated 13,000 deaths from work-related lung disease and cancer, reflecting historical conditions and standards. So there is a legacy that we have to recognise and we have to acknowledge. But 1.2 million working people were suffering from a work-related illness of some kind or another. That represents about 4% of the entire workforce. And 500,000 of those were with new conditions that started during the year. 500,000 people developed something new in terms of ill health last year that they didn't have before. That tells you the size of the challenge we face. Work-related ill health is a problem for every section of society, and solving it requires action across every business sector. It ranges from long latency hazards leading to occupationally linked cancers and other diseases to, in some sectors, it will be more about mental health and stress or musculoskeletal disorders. All of those are health issues. Which are the ones that are most important in your business? The drive must come from all those with a stake in keeping people healthy and fit for work. So today we want to hear your thoughts about this health agenda, where I know here in Scotland we're already thinking about and talking about how to make this an important part of the strategy. The third theme I've already mentioned is about SMEs, supporting them with this straightforward advice, which we're already doing. And as I've said, we've already provided them with simplified guidance, straightforward tools and advice. But we need to do different things and yet more things to help SMEs, because there is a significant challenge in this area. They are a difficult group in totality to reach. More players in the system need to step up to the winner's podium, where their best large businesses and the intermediaries are already gaining more efficient supply chains and productive relationships by pointing the SMEs they deal with in the right direction, actually offering them help, helping them to understand how they can translate some of the good practices that big business has already picked up and make it work for them. It doesn't entail complicated advice or insisting that they do it the way you do it, or creating cost unnecessarily for them. Let's keep it in proportion. But that is really important, that we start to share good practice. And this feeds into the fourth strategy theme of enabling productivity through proportionate risk management. As I've said, and as you will know from other speeches I've made on other occasions, well-intentioned but sometimes ill-informed advice to small and low-risk businesses needs to change. It can leave them thinking that the health and safety bogeyman, the insurers, workers, and anyone else are just waiting to pounce unless they have every conceivable risk, whether relevant or not, under lock and key, and have paperwork in triplicate to cover every situation. That's not what health and safety is about. It is about saving lives, dealing with the real risks, not about the paperwork. And it's in all of our interests to avoid feeding these perceptions that risk assessments mean excessive paperwork, or that risk management means managing all risks, however trivial or remote. It is costly, it inhibits productivity, creativity, and growth, and it breeds cynicism among the people whose hearts and minds we need to win. Managing the right risks in the wrong way is also a way of being wasteful. Focusing on the wrong priorities because they're less challenging is another trap we need to lay bare. Those in the health and safety profession have a particular role to play here, I believe, in helping small companies get it right in an efficient and effective way, with minimal paperwork and a focus on outcomes more likely to mean the company will grow and come back for advice as it reaches the next stage in its development, rather than leaving it drowning in a sea of paperwork. Looking to the future also provides the fifth key theme, which is about recognizing that we are in a fast and ever-changing world. Anticipating and tackling new health and safety challenges is our fifth theme. This, once again, is for all of us. We all need to be scanning the horizon for what's coming. But it's an area where HSE has a particular role. We have world-leading research capabilities, and we're already using them to increase our own efficiency and targeting, as well as helping companies and other regulators here and overseas to improve health and safety and productivity. Our horizon scanning expertise will be used to the full, both by us in HSE, and we hope to assist wider government as demographic, technological, and global economic changes affect the world of work. But we also want to hear your ideas for how we can keep track of trends and changes, as well as any particular challenges that you see on the horizon in your organizations and in your industries. The final theme of our strategy is about sharing the benefits and successes of Britain's approach to health and safety. This is about sharing best practice and knowledge. Health and safety should not be an area where we see ourselves as competitors. We all have a stake in being the best we possibly can across the whole of this country. So sharing good practice at home and abroad is hugely important. Supporting higher standards of protection for workers in countries where it needs improvement is something that I believe we have a moral obligation to do. If we are good, we should not hang on to what we know, we should share it with others. It can help project British influence overseas, and through promoting our goal-based approach, we actually make it easier for British businesses to expand into new markets and territories if we take our systems and our ways of working and help others to become better. If we can all come together to help achieve these things and maintain the gains that we've already made in safety, it will help improve productivity, it will keep business costs down, and most importantly of all, it will keep every one of our workers safe and healthy. Work should not make people ill. When it does, it's a cost that's borne by the individual, by their family, by the business, and by many parts of the state. It is a cost which is avoidable on all counts and is often inexcusable. In HSE, we will continue to take our responsibility as the prime mover in the system very seriously. We want to work with everyone here, with our co-regulators and colleagues across government departments, to ensure that regulation remains simple and effective, and that HSE expertise continues to be leveraged to achieve improvements. Let me just highlight that we estimate £21 million of savings to businesses that HSE's regulatory simplification has brought about in the last Parliament. And let me also highlight the example of HSE and the Environment Agency and SEPA here in Scotland, who engaged in a major project with the major hazards industries on major hazard and environmental inspection planning. By joining up the way regulators work together, we have achieved something which has been of real benefit to business and which business has said how much they welcome. So we need to continue to look for ways to help by working smarter to deliver greater benefit. But the health and safety system cannot succeed in meeting new challenges without broadening that ownership and achieving that step change in the level of ownership and involvement which I've highlighted this morning. I hope that through today's other speakers, the discussions that you're going to have around your tables, and the experiences that I hope and good ideas that I hope you're going to share, that you can help deliver not only the best health and safety strategy in the world, but over the next 5 years, that you will be part of the team who will deliver on the promise. Today is a beginning. It starts with you. You are contributing to our strategy. You are helping to build a safer, healthy, and more prosperous Great Britain, and in particular, for those of you in this room today, a safer, healthy, and more prosperous Scotland. You're helping to protect lives, the quality of life, and livelihoods. You're helping employers to innovate, to be more productive, and to grow. You are, in every sense of the phrase, here to help Great Britain to work well. So thank you for being here. And although it may be premature, I have every confidence in you. So thank you all for your magnificent contributions that you are about to make. Thank you.